Let me ask you something. What if forgetting where you left your keys isn't just about keys at all, but a message from your brain about the way it's aging? After decades of practicing medicine, I've come to realize that memory loss is one of the most feared and most misunderstood parts of getting older. Today, I want to share with you the real differences between normal forgetfulness and the first whispers of dementia, along with the lessons I've learned from patients, research, and my own journey as a doctor, walking beside people just like you. You see, memory is not a filing cabinet. It's more like a living, breathing garden. With age, the garden doesn't vanish, but some pathways become overgrown. You might forget the name of an old acquaintance or take a little longer to recall a word. That's normal aging, and it happens because the connections between neurons slow down, not because the memories are gone. I remember one patient, Mrs. Thompson, a retired librarian who laughed when she forgot a book title but could still remember the smell of old pages and the way she felt when she taught children to read. That's healthy memory. It's slower, but it's still beautifully intact. Now, dementia is different. Dementia is when the very garden itself starts to wither. Instead of struggling to recall a word, you may forget what words mean. Instead of misplacing keys, you might forget how to use them. And here lies the important question we all ask. How do I know the difference? In my years of practice, I've learned that the red flags are not about occasional slips, but about patterns. A man who forgets his daughter's birthday once may be distracted, but when he forgets how to get home from a neighborhood he's lived in for 40 years, that's different. Let me share a story. One of my patients, Robert, an engineer, came to me because he was misplacing tools. At first, it seemed normal, but then his wife noticed he struggled to follow the steps of a recipe he'd cooked for years. That's when we began investigating dementia. It wasn't the forgetting alone. It was the loss of ability to function in everyday life. And this is where I want you to pause for a moment and reflect. How often do you dismiss your own forgetfulness as just old age? Because sometimes it is, but sometimes it's not. And knowing the difference could change your future. One of the greatest misconceptions is that every memory lapse is dementia. That's simply not true. Depression, thyroid problems, vitamin B12 deficiency, even lack of sleep can mimic memory loss. I've seen patients undergo months of worry, only to discover their memory improved once they treated sleep apnea or started eating better. The truth is, your brain is connected to your whole body, and when the body suffers, the mind follows. Here's something else research is teaching us. Brain resilience is real. People with strong social connections, regular physical activity, and mentally stimulating hobbies often show fewer symptoms, even if changes are happening inside their brain. I've seen widows who learned to play piano at 70 and watched their memory sharpen. I've seen men who joined walking clubs not only reduce their heart risk but also stay sharper mentally. It proves one thing: the brain is never finished growing, even at 60, 70, or beyond. So let's talk about what you can actually do. The science is clear. Exercise keeps blood flowing to your brain. Even a daily 20-minute walk makes a difference. Nutrition matters more than you think. Leafy greens, berries, olive oil, and fish literally feed your neurons. Sleep is when your brain takes out the trash. It clears away harmful proteins linked to Alzheimer's. I cannot stress this enough. Early detection matters. Treatments for dementia are not perfect, but they are improving. Medications, lifestyle programs, even emerging therapies can slow progression when caught early. Think of it this way. Would you rather check your blood pressure after a heart attack or before it? The same is true for memory. Over the years, I've seen families who came in early, and we were able to plan, treat, and adapt together. And I've seen others who waited too long, and their choices became fewer. This is not about fear. It's about empowerment. It's about listening to the small signals before they grow into shouts. What stands out are not just the medical charts, but the stories. The father who wanted to remember his grandchildren's names. The artist who wanted to keep painting. The teacher who wanted to keep passing on wisdom. Memory is not about perfection. It's about preserving the essence of who we are. So, here's the silver lining. Memory decline is not always dementia, and dementia is not always the end of your story. With awareness, with lifestyle changes, with courage, you can protect your mind and make the most of your years. I want to leave you with a question. What memory in your life is most precious to you? Hold it in your heart, and let it remind you why caring for your brain is worth it. If this conversation has inspired you, please subscribe, share this with someone you love, and join me here at Silver Lining Talks, where we explore not just the science of aging, but the art of living well. Until next time, take care of your mind, take care of your body, and never stop nurturing the garden of your memory.